Hello everyone. It's that time where we've come to the final session for the afternoon. Thank you all for still being with us and being a part of this next session. My name is Erin Fatt. I'm the Chief Operations Officer at AMSANT. I'm an Aboriginal woman born and raised on beautiful Larrakia country. I'd like to firstly acknowledge the traditional owners of the land, the Aranda country that we're meeting on today, past, present and emerging. I've worked in the art show sector for over 20 plus years and been involved in a lot of these forums, and it's great to hear a lot of the feedback and the input and the stories that we've heard from over the last couple of days. So for our next session, we've got a discussion with our amazing expert panel up here, talking about the next steps from this Diabetes Summit. So if I can start with Dr John Patterson to introduce himself, an overview of where you're from and what you do.
Thanks, Erin. Yep, Patto, otherwise known to many of my colleagues. Recently honoured with the honorary doctorate from Charles Darwin University for my work over all these years. Born and bred, Territorian, country, Nullican. Yeah, thank you, thank you. I was wondering when they're going to start recognising, you know, gammon. But look, my grandmother's country, Nooka, Nullican, I'm part of the Nullican tribe out that way. Proud Territorian, and you would have seen my advocacy, my passion, commitment, and you know, work that dedication that goes into getting our most vulnerable population health needs and well-being. You know, we've got to lift all those terrible statistics that we see right across the board, including diabetes. I mean, we were warned about 10 years ago by, I reckon, Professor Alan Cass and others that came and presented at an AMSANT members meeting and said, there's a tsunami coming and we've got to start preparing for it. And well, that tsunami's getting a little bit closer now, and I think I'll elaborate a little bit more in the question, but we've got to be prepared for it and start to, I believe, get a little bit at equilibrium in terms of funding and get it upstream rather than, like somebody said earlier this morning, waiting at the bottom of the cliff for our casualties to fall over. But yeah, CEO of AMSANT, I do wear a big mob other hats, but that's me.
Thank you. Hello everyone again. Yes, so Rob Moore, I'm the Executive Manager for Strategy, Planning and Performance at the Northern Territory PHN. Listening to what you were saying, Erin, that scared me a little bit, because I was sitting here thinking, I've actually been in health for 42 years now, and so I've got a nursing background, started off in the old days at the Royal Adelaide Hospital, hospital-based training, that was the real training, yeah, really looking forward to the questions today, but also looking forward to getting some real meaningful action out of the end of our day so that we can really take some steps forward. Thanks.
Hi everybody, I'm Frank Daly. I'm so sorry I was late this morning. So I am the Chief Executive of the Department of Chief Minister and Cabinet here in the Northern Territory. I'm very experienced in that role. This is my 15th working day in that role. You've got me on the time, but after 33 years working exclusively in the health sector in one role or the other, if you count my internship in Royal Perth Hospital in 1989, I've moved into a much broader and scarier role in some ways. So Chief Minister and Cabinet is an exciting role because you're at the very epicentre of government. You're the Secretary for Cabinet. But interestingly, there's a lot of work done by some very clever people, across both Aboriginal, social, environmental and economic policy. And it's great that can be interconnected, and we might talk about that a bit more later. But I'm very excited to be in the role because of the opportunity that centrality and situational awareness gives us from a government point of view.
Check 'em on. Tamsin Cockayne. I'm in a new role. I've been there longer than you, Frank. I've been there for 4 weeks now. So it's a role, the Executive Director of Strategy, Planning and Reform in the Department of Health. I come from a background very much in primary care and remote care. I've now lived in the Territory longer than I lived in Sydney when I grew up, so I feel like I'm almost a Territorian. I've got 2 Territorian children. My real interest through my career has been the interface between clinical service delivery and the other parts of the system. So I'm really focusing on that. How do we align our policy, our strategies with what actually happens at the coalface and with what our communities need and want?
My name's Alan Cass. I'm Director of Menzies School of Health Research. I'm not in a new job. I've had the privilege of being in that position now for 10 years. I'm a kidney doctor by training. I was born in Sydney and went to medical school and did my training at Royal Prince Alfred next to the university. Interesting because we were the hospital next to Redfern community, so there were some strong links with the community and engagement with the Aboriginal Medical Service there. But when I trained as a kidney doctor, at the time we provided care to Western New South Wales. So we would go out as a trainee, as a registrar, to Burke, Berowra, Dubbo, and all of the patients on dialysis certainly in Berowra and Burke were Aboriginal. And I went back to the unit where I was doing my clinical training and said, do we understand why that is and what's happening and what's underlying those health challenges for Aboriginal people in Western New South Wales? And I wanted to do research addressing that. I looked around Sydney University at the time and there was no one working in that space. Went home and there was a letter in my mailbox. That was when we still had letters in mailboxes, from the Kidney Foundation saying there was an opportunity to do research looking at, what was it called, the antecedents of kidney disease affecting Aboriginal communities in the Northern Territory at Menzies School of Health Research. I hadn't heard of Menzies School of Health Research at the time, but I went in to my wife and said, we're going to move to Darwin. She said, you're an idiot. Of course, we're not going to move to Darwin. But we came up and looked at it and loved it. So that was in 1998, and I came and did research at Menzies and worked as a kidney specialist at Nightcliff in the hospital. Interestingly, my work, the title of my PhD was The Social Determinants of Kidney Disease Affecting Indigenous Australians. And that was 25 years ago. And I explored the links between house crowding, poverty, unemployment, low birth weight, and low educational attainment and chronic disease. You could be glass half empty and say, why are we still having to discuss all those social determinants today? But I think that's wrong. It's been so wonderful to hear the passion and the ideas for things that people want to implement. I was incredibly impressed by Donna Roche's, talk yesterday morning. We can think together and come out of this meeting with some really powerful suggestions about interventions, things that can be done with community engagement, community representing priorities that will change our workforce, build capacity within all of our services that will reflect priorities and engage with and challenge all of the arms of government to do things that will have an impact. So I hope that's what we come out of today.
Great. Thank you, everyone. So we've heard over the last 2 days from a number of great speakers with lived experience, presentations from researchers and panellists. Diabetes is not new to many First Nation people and communities. However, many struggle to understand the why behind the why. So our first question is for Frank. So in your new role as CEO for the Department of the Chief Minister and Cabinet, how do you envisage a collective approach to improve the social determinants of health across the NT?
A collective approach. I think, as Alan has just said, there is enormous opportunity in the Territory. One of the reasons I took this job is because I'm actually really excited about a future in the Territory, not just for myself and my family, but for all Territorians. I think collectively, we, as Territorians, we all have to acknowledge the inequity in our society. I think we have to, talk on equal terms, not just of the social determinants of health, but I've become much more acquainted recently with the concepts of the cultural determinants of health as well. And I think listening to the panel this morning that I came in and heard, that came through so loud and clear. I think many of us have yet to have a full, real comprehension, if we're not Aboriginal, of what that means. And I think that's really important that we do. If you look at those cultural determinants of health, they're basic things like educational attainment, quality of housing, access and attainment of education, economic opportunity. I was in a remote Aboriginal community which was quite troubled this week, and number one and number two in the community problems are alcohol and boredom. Which leaves, fallow territory for trouble, and disenchanted, disempowered and disillusioned youth who don't feel they have a future. And of course, ill health and being acquainted with the inside of correctional facilities and all that sort of thing is to follow. So I think we have to think about that holistically. With the economic opportunities in the Territory, something which I'm now just starting to fully understand what the possibilities might be, there's a chance that economic and social inequality may increase, and we can't let that happen collectively. So I think it's really important that Aboriginal people in the Territory don't become bystanders to that. And observers, and I think that we have to fully engage with the Aboriginal community, the land councils, and all of the organisations to ensure that that the principles of local decision making, of self-determination and empowerment actually mean something, and that Aboriginal people are part of the economic future of the Territory, and that's more than just things like royalty payments or token targets, if you like, around Aboriginal employment. It's got to be a little bit more than that, I think. So I think those concepts are really important, and having a conversation in the Territory about that, I think, is important, and we have to balance the importance of our environment and sustainability in the future as well. So it is actually a tricky conversation to have, but I think we have to do that. And I think at government level and across the great relationships that we obviously have across this sector, I think we can have that conversation. And obviously inside government, lining up those important parts of policy development and implementation is what we've got to learn to do better. I hope that answered your question.
Thank you. And I think that's some really good points about not only just the social determinants, but the cultural and economic determinants as well, and doing that collectively. So our second question is for Patto. So diabetes and chronic disease, as we all know, is the biggest killer of First Nations people. What role do you see the NT Aboriginal Health Forum play towards the implementation of the roadmap that will be developed from the NT Diabetes Summit?
Thanks, Erin. Good question. And I guess when it comes to the Northern Territory Aboriginal Health Forum and what we can do, I guess the strength and the advantage of it, I chair it. I chair it with all our partners. So Frank, prior to, although he might come back again because we've just expanded the membership of Forum, Northern Territory Aboriginal Health Forum. So AMSANT chairs it. We have members from our sector, board directors. Commonwealth Health, Northern Territory Health, when Frank has been attending. And I might just say that Frank's demonstrated to us his commitment and passion to want to see improvements in that health space by being one of the few chief executives of the health department to actually come on a regular basis and see it as a important senior strategic forum to have those very discussions. Other partners, NIAA. Why NIAA? Because they've got funding for alcohol and social and emotional wellbeing programs. Northern Territory PHN declare an interest. I'm also director on the board of PHN, but again, PHN's commission, they receive funding from the Commonwealth for a broad range of initiatives and programs and services that are targeted for our population, our communities here in the Northern Territory. And we've just extended an invitation as a result of expanding it to the two new members being Chief Ministers and Cabinets now, which Frank will decide who the rep be. The other new partner is NDIA. Why NDIA? They have a big responsibility of delivering disability services to our clientele and our population here in the Northern Territory. And we need to get, and have a shared understanding of what their engagement is, what their relationship is, how they're delivering those services to our disabled population here in the Northern Territory. So that hopefully we've got all of those responsible agencies and both Commonwealth and Northern Territory government, including the community controlled sector and PHN being a commissioning agency, sitting around the table, having a shared understanding of what the pool funding is, and then hopefully having a mature discussion, debate that's evidence-based, well-researched, to enable us to have an informed decision about where we can allocate those desperate resources. Where are those emerging trends of illnesses and other health issues arising throughout the Northern Territory, and hopefully collectively come up with a plan of service delivery. So I think, and from my perspective, I think the Northern Territory, I might also say that I'm the Aboriginal Peak Organisation's Northern Territory APONT, represented on the Joint Council of Closing the Gap. So I sit at that table on a regular basis with, that's going to be co-chaired by Minister Burney and Pat Turner, who's the convener of the Coalition of Peaks. So I'm privy to participate at these jurisdictional forums, having the advantage of getting all the inputs, feedback, issues, concerns being raised by our members, the AMSANT members, at regular forums, to be able to give me the information to go to these meetings and present the Northern Territory